Good morning, welcome everybody. It's great to have so many of you here today. My name's Ruth Garside. I'm an Associate Professor in Evidence Synthesis working at the European Centre for Environment and Human Health. I'm going to talk a little bit about community solutions to benefit nature and human health and the work of the European Centre over the last 10 years. So we're all aware that we're facing unprecedented challenges for the planet and for humans who make their home on it. We've got massively increasing population levels, hugely increasing urbanization, where large numbers of people are coming together to live in urban areas with all the challenges that has for the environment. We know that we've got changes in the levels of atmospheric gases, and CO2 levels are rising really steeply, and that global temperatures are rising as they never have before. And along with that, we know that we're losing a lot of forest cover. We've got rising temperatures and melting ice caps. There is challenges in the oceans with warming temperatures and increased levels of acidity in the oceans, and increasing extreme weather events, floods and storms, causing challenges to people and wildlife alike. And these challenges have been recognized globally, nationally, regionally. We know that we hosted the G7 recently in Cornwall, and some of the key aspects that they were thinking about revolve around global recovery, resilience against future pandemics, which we know may be increased by some of the human activity and coming into contact as never before with wildlife populations. They're also focusing on tackling climate change, preserving biodiversity, and championing shared values. And coming up later in the year, the COP26 in Glasgow is also focusing on global warming, trying to keep global warming to a minimum, trying to adapt to protect both communities and natural habitats, and working together between governments, businesses and society to try and deliver on this crisis and challenges. Here in Cornwall as well, there's a really strong focus on environmental and health issues, looking towards a carbon zero economy, sustainable food, thriving places and decent homes, health, safe and resilient communities, amongst others. And these problems and the solutions to them are messy, they're multiple and they interact, they're transnational and transsectoral, and they operate across all levels from the local to the global. And the work of the Centre over the last 10 years has really been speaking to a number of these issues. And until recently, the value of the natural environment as a health asset was lacking in both health and environmental policy. The way that the Centre works, which is both interdisciplinary and collaborative, working with governmental bodies, with NGOs, with local businesses, with local communities. We believe we've led to a paradigm shift in how health policy, environmental planning, and public health practices have sought to harness the potential for natural environments to support health. Some of the research that we've been doing has highlighted key findings which speak to this. For example, starting to both quantify and qualify the ways in which natural environments can promote health, and linking that to health economic values of well-being benefit of visits to natural environments. We've also done research which shows that moving to greener neighbourhoods can improve health, and identified opportunities and strategies to work across different policy sectors and with service delivery. So what's changed in the 10 years since we began? Research from the Centre has changed policy mindsets, strategies and practice. This includes evidencing the ways in which human health and well-being depend on environments and well-functioning ecosystems, which was historically poorly recognised in both environment and health policy. So our evidence has strengthened conservation, environmental management and investment policy by clarifying and detailing the role of natural capital in supporting human health and well-being. The other change is that traditionally environmental policies relating to human health have been dominated by hazards or risks from the environment. And while the Centre does examine these, a lot of our research has also meant that this is now balanced by the recognition that health and well-being benefits are gained from good quality natural environments. And this research has been amplified through our active engagement and collaborations with policy bodies, as well as I said, governments, NGO, and local communities who've recognised our expertise and invited participation in a range of advisory roles and joint projects. So just a brief example of the impact of our research at international, national, and local levels. We know that the research that we've done has influenced the work of the World Health Organization. For example, they've now urged member states to take action on enhancing urban green space for health, thinking about the range of benefits from parks, from street trees, from addressing heat island effects, pollution, and so on. Nationally, we've influenced policy decisions. For example, the UK government has recently invested more than £15 million in natural environment-based population health promotion programmes, including environmental social prescribing schemes or nature on prescription. And locally, we've changed public health and third sector practice in Dorset and Cornwall and stimulated for direct investment. For example, the EU investment in £3.5 million in urban public open space in Cornwall aims to improve both health and biodiversity. So we're really looking forward to the next 10 years to continue the way that we work across disciplines, across different organisations and with local communities in order to address these urgent issues of climate change and enhancing biodiversity and human health into the future. Thank you.